In this lecture, we are going to discuss how to critique a randomized controlled trial using CONSORT Checklist. I have given the link of this article as well as CONSORT Checklist and the explanation article of CONSORT Checklist in the description. I would suggest you to download and go through those articles before starting with this video. So the topic of this article is effectiveness of school dental screening on simulating dental attendance rates in Vikarabad town, a randomized controlled trial. This is a prologue. It is a description of the topic for the audience for making them understand the topic before we are discussing the article. So it is a good idea to discuss about the topic before starting with the critical analysis. So here the article is about school dental screening. So I have given a prologue about the school dental screening, the schematic arrangement of this process of school dental screening. I have shown the types of examination, and then I started with the critical appraisal of the article. So let's start. So the aim of this study was to determine the effectiveness of school dental screening on stimulating the dental attendance rates among school children in Vikarabad town. And the objectives were to compare the dental attendance rates between 6 to 9 and 10 to 13 years old age groups among male and female school children in Vikarabad town, and to identify the type of dental treatment received by the school children. So firstly, we will describe about the article, what type of article it is, what's the volume number, issue, year, the page numbers, when it was published, whether it is PubMed indexed or not, and the digital object identifier. Then about the journal, we will write about the name, the publication start year of the journal, its frequency of publication, the country of publication, the publisher, the languages in which it is published, the ISSN number, impact factor, and whether it is peer reviewed or not. About this ISSN number, impact factor, about these terminologies related to journal club, I have given a video previously also. You can go through that video, and the link for that video is given in the description below. So the authors have been mentioned, their departments have been mentioned, but their designations are not mentioned. Their institutional attachments are mentioned, and the details of the corresponding authors are also mentioned in the article. Now this is the title. We'll describe about the title. It is a descriptive title. Okay, I've discussed this in my previous lecture. The types of titles, there are 3 types. So amongst them, this is a descriptive title. It is meaningful. It indicates the topic and the focus of the study, the aim and the primary objective of the study, and the study population is mentioned, that is the school children, but the age range is not mentioned in the title. The study setting is mentioned, that is school, and it indicates the research question. As I have given these pointers about when I am writing the study population is mentioned, on the right hand side I have mentioned that school children is mentioned. So it is a good idea for the audience to relate. So we should write this with the description. Then the variables are mentioned. So we should see what are the independent and the dependent variables in the title. So here the independent variable is school dental screening and the dependent variable is dental attendance rates. Okay, so we are seeing what all things are affecting the dental attendance rate. So this becomes the dependent variable, while what all factors will affect the dental attendance rates, these will be the independent variables. Okay, now the title over here comprises of 17 words, and the study's design is mentioned in the title, but the duration is not mentioned. The proposed alternative title over here is Effectiveness of Screening on Stimulating the Dental Attendance Rates among 6 to 13-year-old children in Vikarabad town, a randomized controlled trial. Now we come to the abstract. When you'll go through the article in which the explanation of the CONSORT checklist is there, you will see this table, the table number 2. Here they have described what all should be included while reporting a randomized trial in a journal abstract. So all these pointers we are going to see whether they are mentioned or not in the abstract. So over here you can see I have written what all is mentioned, whether the authors, the trial design is mentioned, what about the participants and intervention is mentioned, about the objectives, outcome, randomization, the results, the recruitment, the numbers analyzed and the outcomes, all these things, the harms, the conclusion, the trial registration, funding, whether they are mentioned or not, we all have to see these pointers. So the critical appraisal of the abstract, it is structured, informative and comprehensive abstract. It gives a brief overview of the whole study and it is comprehensive in its contents. So here over here we have to describe about what all things are included in the abstract and whether they are matching with the checklist or not. Okay. So the keywords proposed by the author are dental attendance rates, dental screening program and the school children. So I searched them on the mesh browser, which I've mentioned in my previous lecture. You can see the link over there. So over the mesh browser I found that none of them is a mesh term. Okay. So this is the CONSORT checklist, the title and the abstract, item number 1A and 1B. I've seen whether they have mentioned them or not, and I've mentioned the title, whether randomized trial is mentioned. I've shown the description over here. For the abstract also I've shown the description over here. That yes, this is mentioned. Where it is mentioned I've shown over here. So it is a good idea to show this to the audience so that it becomes easy for them to understand. Next we come to introduction. This is the background. You have to see how they have started the article. It is a funnel shaped type of introduction. So they start with the background. They'll describe about the screening, the aim of the screening and earlier what was done. So all that I have mentioned over here. Then the rationale, the need of this study, that should be mentioned. Okay. So the critical appraisal of the introduction, it is meaningful, concise and logically presented, and the approach which they have used, I've mentioned this also in my previous lecture, what kind of approaches an introduction can have. So this kind of introduction is a seminar approach in which they have elaborated everything in a seminar kind of manner, and it is written based on existing literature. The rationale or the reason for conducting the study is justified. So there it is an explanatory type of rationale, okay, which is assessing the possible influence of an intervention, okay, and they have mentioned all the previous trials also. Okay, then the aims and objectives of the study are mentioned. Now we come to CONSORT checklist. Item number 2A and 2B are mentioned. I've shown over here what the item number 2B wants, the specific objectives. I've shown what all objectives were there in the article. Then we come to methodology. What methodology they have used, I've mentioned over here. How the selection of participants was done, I've shown here of in the form of flow diagrams for easy understanding of the audience. Okay, the eligibility criteria, the informed consent, study group, control group, and the follow up, the statistical analysis which they have used. Keep the data or the matter in your slides very less. It should be short and crisp for the audience to easily understand and go along with the this journal club critical appraisal. It becomes very cumbersome for them to understand when the slide is packed with text. Okay, so this is a critical appraisal of the material and the methods, the permission and the ethical formalities, whether they have been mentioned or not have mentioned. Then the sample size calculation, about that I've written. The recruitment of the study subjects, the study design, how it was, it is an experimental or interventional study, a longitudinal study or a control study or a concurrent parallel design. And when it is a randomized controlled trial, I have to mention about the allocation, concealment and blinding. About these two topics I'll and the confounders, I'm going to discuss them in detail in my next lecture. Okay, and the statistical tests which they have employed are appropriate or justifiable or not, that we have to see. Now this is a CONSORT checklist. You can see again I've mentioned everything over here from the text I've taken. the pointers to relate, okay, whether the trial design is mentioned or not. Like they have written description of trial design such as parallel or factorial, including the allocation ratio, whether they have mentioned it or not. I have mentioned what specific thing they have mentioned, okay. Design RCT is mentioned, allocation ratio not mentioned. This way if you do, it becomes very easy, okay. Over here also the items I have shown this. Then we come to the results. In results, don't try to copy all the text and paste it on the sides. Yeah, we'll discuss what all they have mentioned, what all they have described, whether the numbers over here are matching with the text or not, okay, whether they have written it statistically significant. I'll check it with the statistical test whether it comes out to be statistically significant or not. I'll check it, and then I'll see the p value whether they have mentioned it correctly or not. I'll see the calculations, and then I'll decide, okay. So here the participation flow diagram they have not mentioned. The recruitment, what all they have mentioned, I've shown over here. The baseline data, the numbers analyzed. Now we come to discussion, what all they have mentioned and how they have related the results which they have got with their study with the previous studies. All this is mentioned in the discussion. What limitations were there, what strengths, limitations were there, and the future recommendations are also there in the discussion. Those things we should mention, okay. The limitations, the bias, for bias also there will be a separate lecture, okay. Here selection bias, performance bias, detection bias, situation bias, reporting bias, all I have written, okay. And the conclusion, other information like the conflict of interest, whether it was there or not, they have mentioned or not, the funding or the support, if they have taken any funding or grants from some institution or not. This we have to see and we have to mention over here, okay. So this is the CONSORT checklist again. Then the references, we have to see whether they have made references for every citation in the text or not, what style of referencing they have used, have they been written properly or not, and most recent reference cited, which year it was, okay. So this is how we critically appraise the randomized control trial, okay. Any doubts, you can write them in the comment box. I'll surely reply to them, okay. Thank you.